Use of antibiotics in dermatologic surgery or skin surgery is a question of debate, and that's primarily because prolonged antibiotic use in people who might not need it can lead to resistance and unnecessary side effects pertaining to antibiotics, such as disturbances in your microbiome, all kinds of upset stomachs. This particular paper wanted to answer is, does giving antibiotics before a surgery for patients who are slightly higher risk for joint infections, heart valve infections, do these patients benefit or not if we were to give them antibiotics before the surgery? The normal guidelines these days essentially advocate for prophylactic or pre-procedural antibiotics to be administered to these patients to reduce their chances of infectious endocarditis, which is an infection of the heart, infection of the heart valves, or people who have prosthetic joints, like maybe your grandma who has a knee replacement with titanium or something. If these patients have these replacements in the last 2 years, they're at a little bit of a higher risk for getting that artificial joint infected. And so we typically give prophylactic antibiotics before we do any surgeries. The question in this paper was, does that actually make a difference or not? And interestingly, what they did is they looked at a database that contains over 150 million patients, of which they identified slightly over 1 million patients who received skin surgeries. And they divided those patients into patients who received prophylactic antibiotic therapy, which means antibiotics before their surgery, and those that did not. The outcomes were basically whether these patients had any form of infections, whether they were more serious infections like the heart infections or joint infections, or infections just at the surgical site in the first 30 days after surgery. And they wanted to know if the antibiotic group did better than the ones that did not get antibiotics. First of all, when you jump to this table, what you see is we look at the p-values, and I see that there's only 2 significant parameters where there's actually a statistical difference. 200 patients with prophylactic antibiotics had positive blood cultures versus 210. The second thing is surgical site infection. The group that had prophylactic antibiotics ended up having 30 cases less of surgical site infection. Positive bacterial blood culture and the surgical site infection were lower in prophylactic antibiotic therapy patients. However, everything else from infectious endocarditis, prosthetic joints, wound cultures, there was no statistical difference whatsoever. So the central premise of this paper is to tell us that when they looked at this 1 million plus group of patients, they didn't notice any difference in serious infections between patients who were treated with prophylactic antibiotics and those who were treated without antibiotics, which means that perhaps we don't need to use these antibiotics because dermatologic surgery is a very safe surgery. And so I hope that this helps shed light on lesser antibiotic use and lesser breeding of resistance in society, and of course, more safety for our patients.